We are going to test the range of motion of MP flexion of the thumb. Start with patient seated, with elbow flexed, and the forearm in 45 degrees of supination. The wrist should be in neutral position and supported on a firm surface. The axis of the goniometer should be placed on the dorsal surface of the MP joint. Stationary arm is over the thumb metacarpal, and movable arm is over the proximal phalanx.
Now flex your MP joint. Normal range of motion of MP flexion is 0 to 50 degrees.
Now we're going to test IP flexion. Use the same starting position as when you tested MP flexion. Place the axis on the dorsal surface of the IP joint. The stationary arm goes over the proximal phalanx, and movable arm goes over the distal phalanx.
Now flex your IP joint. Right at 80 degrees. Normal range of motion of IP flexion is 0 to 80 or 90 degrees.
Now we are going to perform manual muscle testing for thumb MP flexion and extension and thumb IP flexion and extension. For thumb MP flexion, the patient should be seated or supine with the forearm fully supinated. The wrist is in neutral position and the thumb in extension and adduction. First, stabilize the metacarpal and the wrist.
Now I'm going to see you flex your MP joint. Great. Now I'm going to add resistance on the proximal phalanx. Now flex your MP joint. Good.
Now we are going to test IP flexion of the thumb. Start in the same position as when you tested MP flexion. First, stabilize the wrist, the first metacarpal, and proximal phalanx of the thumb.
Now I want to see you flex your IP joint. Good. Now I'm going to add resistance. Now flex again. Good.
Now we are going to test thumb MP extension. The patient should be seated or supine with forearm in mid position, the wrist neutral, and hand and forearm resting on the ulna border. The thumb should be flexed at the MP joint with the IP joint extended. First, stabilize the wrist and the thumb metacarpal.
Now I'm going to palpate her extensor pollicis brevis at the base of the first metacarpal. Now, I'm going to resist on the proximal phalanx and get you to extend your MP joint while I resist. Good.
Now we're going to test thumb IP extension. Start with patient in same position as when you tested thumb MP extension. This time the MP joint of the thumb is extended and the IP joint is fully flexed. Stabilize the wrist, first metacarpal, and the proximal phalanx of the thumb.